Angela Clendenin joins me now from College Station, Texas. She's an epidemiologist over at Texas A&M School of Public Health, specializing in emergency management. Angela, it's a pleasure to have you on the show. After a natural disaster like this, something that has affected such a large area of land, over 100,000 square kilometers, over 13.5 million people affected, I'm wondering if you could sort of elaborate in terms of how important the role of exchanging information is.
Exchanging information across response groups, across public entities, schools, communities, governments, all of that becomes really important because everyone gets impacted and they all have to come together and be on the same page in order to be able to have an effective response. One of the things that we learned multiple times with natural disasters and other types of man-made disasters in the United States, you can look at after-action learning, and communication is always the one thing that needs to be improved. And so communication, cross-communication is essential.
And that is being done by the country's emergency or natural disaster management, AFAD. In terms of emergency management and what this agency is trying to do, what do you think are some of the big challenges after not just one major earthquake, but two, and you having over 1,000 aftershocks?
So one of the biggest challenges, particularly with earthquakes that lead to these multiple aftershocks, is the ongoing risk that the emergency responders are putting themselves in as buildings can continue to be unstable and collapse. So there's a tremendous risk for them to be in harm's way. Also, people trying to flee, the weather there is really cold, and being able to find shelter where they can be warm, they can be fed, there can be clean water. You have to worry about ruptured pipes and having contaminants introduced into drinking water systems and sewage water getting introduced into those systems. So there are a lot of issues beyond just looking for people that emergency managers are having to, and emergency responders are having to deal with.
You gave an example of how the U.S. actually deals with this. I'm wondering how much you think cultural and social influences on communication play a role here.
So cultural and social influences on communication are significant. We all use different channels, formal and informal networks, to communicate with each other, to have check-in safe or missing people, and to try to get the word out. But one of the things that I've seen in all the footage from Turkey that seems to cross all cultural boundaries is that when disaster happens, people pull together, and it doesn't necessarily matter who you are or who your neighbor is, but people are helping people, and you really start to see some of the very best in people.
We have just witnessed another miraculous rescue just moments ago, but the reality is that in a fairly considerable short time, this will transition from a mainly search and rescue operation to, unfortunately to say, a cleanup operation, and then the attention sort of shifts to attending the urgent needs of the hundreds of thousands of survivors. What are some of the challenges there?
So with all the building damage, it's not just residential buildings or businesses that were damaged. A lot of the healthcare facilities were damaged as well. And at the same time, you have a huge surge of people needing medical attention. You'll also have ongoing needs for psychosocial support, and those resources are probably taxed right now, just trying to find a place to operate out of. So having, shelters that'll probably be in place for quite some time, having the professionals that can go in there and deal with the psychosocial needs of some of the people who have been impacted, and then helping the healthcare system get back up and running to be able to deal with some of the short-term and long-term injuries that we can expect to see.
I'm going to go back to sort of making this reference to these two powerful earthquakes affecting such a large area, and just the sheer a number of people who have been impacted. Yes, it's 13.5 million people, but the World Health Organization says up to 23 million people may have been affected in some way or another. The importance of psychosocial services plays a critical role as we transition into this new phase in dealing with this crisis.
Absolutely. People may not even be aware of the impact that this disaster has on them emotionally and mentally. It may be months, it may be years. You could feel perfectly fine 6 months from now, and then something could happen that triggers this sort of post-traumatic stress response. And so it's very important, and not just the people who have been impacted or who may have lost loved ones or who may have been injured or have lost livelihood, but also those responders. It is not easy to work, around the clock in the hopes of finding people still alive, and then knowing at some point it does transition to a recovery operation versus a rescue operation. And they still have to consider, when they do find people who unfortunately have been killed in this accident, they still have to deal with, the bodies and things like that. And that can be very mentally taxing on responders. So that psychosocial support is something that's going to have to be in place probably for the foreseeable future.
I want to go back to what we're experiencing now. You said that one of the things that has actually struck you in terms of how the country is dealing with such a natural disaster like this is that everyone is pulling together, and there are lots of rescue teams on the ground. I think the latest numbers show that there are rescue teams from over 70 countries. And they may not be speaking all the same language. In fact, that is most likely the case. But how does communication, and this is something that sort of transcends communication in a traditional sense?
It absolutely does. When you look at most countries around the world, they have some sort of standardized command and control system or organizational structure. And it's very similar, I have found, in multiple countries. Some of the responsibilities may be aligned a little differently. Fortunately, the vast majority of responders do speak English as a second language. And, if you've seen one chainsaw or one crane or one bulldozer, they all are fairly similar. So that language barrier, yes, it can be a problem, but in the response world, it's something that we've been fortunate that around the world we've been able to overcome.
Angela Clendenin, thank you very much for joining us here on our continuing coverage. I do enjoy listening and hearing your analysis. Thank you.